Well, good afternoon. Thank you, Dr. West, for the introduction. I've been asked to give some practical assistance and resources to, reduce or minimize the financial toxicity, we could say, of cancer care. And so I work in the trenches with patients day in and day out, managing the business end of their disease. And just to give you a little background on Patient Advocate Foundation, we were founded in 1996 upon the passage of legislative reform that ensured all health plans in the state of Virginia to offer coverage to breast cancer patients for high-dose chemo in combination with bone marrow and stem cell transplantation. And our case managers today, they mediate on behalf of patients to provide avenues toward access to care while searching for sources of reimbursement. And I work on the clinical appeals team. We're very much involved with submitting prior authorizations and insurance appeals, in coordination with oncology providers to obtain access to personalized or targeted therapies. And this is probably very obvious, but a lot of these targeted therapies are treated differently than provider visits or hospital services. They must be paid in advance. Your prescription copays and cost sharing must be, paid at the time the drug is dispensed. So there's really no room for negotiation. Now your IV and infused therapies are still covered under the major medical portion of your plan, as well as some oral chemo in certain states where there's parity. So those kinds of costs sometimes can be billed to the patient and managed over time. Location and type of pharmacy can affect convenience and access. Many patients will have to work through a preferred in-network mail order specialty pharmacy for their drugs. Many times the pharmacy benefit there'll be a manager involved with that, and they'll have to work with the plan to secure that authorization or approval. And in that case, there can be some delay in that whole communication. Now with the Affordable Care Act and all of the regulatory pressure that is pressuring insurance plans, many insurers are tweaking or adjusting their medication tiers, and that has the result of shifting a lot of cost over to the patient. We see insurance plans with as many as 5 or 6 prescription tiers, very, very high cost emerging, from principally these very personalized therapies. This happens a lot with high-cost chemotherapeutic, immunologic, and these targeted therapies. And so there's no standard pricing that limits retail cost. There's no blue book or contractually adjusted, rates for these drugs. So each patient scenario really requires an outside-the-box look. And so first and foremost, our case managers will look at insurance coverage. We'll try to optimize your insurance, whether it's through the federal or state marketplaces, through your employer, through the private sector. We'll look at your Medicare plan, if that's the case, and try to help you optimize that coverage, whether it be through an Advantage policy or a standalone Part D plan. There are manufacturer-free drug programs out there, and those are typically designed for the uninsured, but also there's some programs out there for those who are presented with a financial hardship. Pharmaceutical assistance programs exist. We'll talk about those when we move into the tumor types and mutations. Copay cards, discount cards are there. Many of the manufacturers are coming out with these as a rule of thumb. And then nonprofit copay programs exist as well. These are 501c3 organizations that have very flexible income guidelines. They accommodate quite a lot of people, and you should be made aware of those. So we have alternate funding as well to offset expenses. That might be premium subsidies, your local or regional cancer charities. So as we move into tumor types and mutations for the EGFR patient population, The Tarceva or Alatinib patient support program exists, and it's meant to help not only uninsured patients, but also on a case-by-case basis for Medicare and underinsured patients as well. It'll reduce your copay. For Geolitrif or Afatinib, there's a Boehringer Ingelheim program called Solutions Plus that'll reduce your copay to $75. They will also assist you if there's no other funding in place, if you have Medicare, and you've got the phone and web link there. And also for Iressa or Gefitinib, there's an AstraZeneca program called Access 360. All of these programs also offer, benefit verification. They'll also assist you with prior authorization or in some cases, an appeal to your insurance. So they really have a robust kind of reimbursement, service. And for ALK positive patients, we have, and these are just for FDA approved therapies. Patient assistance programs do emerge as non-FDA approved therapies approach approval and are, through the different phases of the clinical trial process. Xalkori is offered through Pfizer Rx Pathways, and it's a program that also offers free medicine or at a savings for patients. Also with Zycadia, which was FDA approved back in 2014. For insured patients, they'll cover up to a limited amount per year. They'll also take a really close look at your finances, so it's not exclusively for those who have, who are uninsured or have a hardship. And then for ROS1 patients, this is a very small patient population, 2% of all lung tumors. Xalkori, actually in April, I believe, of this year, was granted a breakthrough therapy designation and is, FDA approved. And, we've been using the Pfizer Rx Pathways for this drug. They'll actually also offer compassionate use for those patients whose insurer is denying their therapy. Perhaps it's an off-label or non-FDA approved indication for your cancer. And they'll do some insurance counseling as well. And so when we get into the nonprofit groups that exist, these are, so we've got HealthWell Foundation. They will help both privately or commercially insured patients as well as Medicare, and both of those funds are currently open. They provide copay and in some cases per diagnosis premium assistance. They're very drug specific, so they won't cover non-FDA or drugs that are outside of the standard of care for a given diagnosis. Also, Patient Access Network, they'll only assist Medicare patients, but their funds are open at the moment. They're diagnosis and drug specific. You've got some web links there. The Assistance Fund is another one that's currently closed, but they do open at different intervals in the year. The best time to access these programs are usually at the beginning of the calendar year, just for your info. A couple more that we use on a day-to-day basis. The Chronic Disease Fund offers diagnosis and drug-specific help. Our very own copay relief program is the only one that I know of that's not drug-specific. So for lung cancer, they'll go ahead and they'll cover your IV or infused chemo, a lot of the oral agents, the targeted therapies, but also drugs that are used for side effects, and pain medication, et cetera. And so there are various really web services that are available as well. RX Outreach, that program, and it has an income guideline, will actually offer a 90-day supply, and these are for the lower tier medications for some of the more common side effects and hormone treatments, et cetera. You've got your Partnership for Prescription Assistance. Needy Meds is one that I've used since I started with the foundation. It's very user-friendly. It's very geared toward patients who need and are willing to self-advocate. And then RX Hope is very similar. It doesn't have as comprehensive a listing as Needy Meds, but it's an option for you. And then second opinion resources. The Regional Cancer Foundation runs a program called the Second Opinion, and they're actually local. They're here in the city, downtown. You'll have to meet with them in person to take advantage of their service. There's a multidisciplinary tumor board that will examine your imaging and other test results and give you an unbiased second perspective. And then our very own Patient Advocate Foundation Empowerment Series. It's a webinar series that is presented live and then on demand, available on demand. And the topics, change on a quarterly basis. And so with genomic testing, there's Cancer Genetics Incorporated. They're an emerging leader in oncology, testing. They offer reduced fees for uninsured and insured patients. Many of these are on like a sliding scale. Foundation One is also available. We have a collaborative relationship with them. We do a lot of referring, to Foundation One for their patient assistance program. We also work with them for patients whose insurance is denying a medically necessary targeted therapy. If it's considered off-label or if there's just pushback with the insurer, we can request a letter of genomic rationale from Foundation One and use that to draft and submit an appeal on behalf of patients. And that's for those of you who, of the population who have issues with off-label or what they would consider experimental treatment. And then we have Myriad Pro, which is another financial hardship assistance. We use them more often really with breast and ovarian cancers, primarily. And some more practical assistance around transportation. Cancer Care offers grants for men and women with metastatic non-small cell lung. And also have a much larger grant for those of you who live in New York City, in Southern California, San Diego, and Imperial County, New Jersey, and Connecticut. We have a brand new financial aid fund as well for metastatic lung cancer patients who are receiving IV-infused chemotherapy. And then ACS, or American Cancer, has their Road to Recovery program and offer gas cards if available in your area. And we put together a mobile app that's very user-friendly that you can use while you're waiting for your doctor or in the infusion suite, et cetera. It's very helpful. You just have to input your age, your state of residence, your diagnosis, and up to four medical or non-medical needs that you have, and it will populate a list of resources that can be emailed to you. And that's really it. I just wanted to kind of rush through these. I know I've left out a lot of detail. I could probably go on for quite some time talking about patient assistance. But whether you're a patient or a caregiver or a healthcare professional, avail yourself of the services that we provide, our case management and copay relief services, especially if you have a really complex issue or if your insurance plan is really giving you some challenges. Definitely contact us. Thanks so much.